The views expressed are solely those of the speaker and not necessarily those of Paltalk.com, ABM Software, or its advertisers.
News Talk is online. News Talk Online is a production of Paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users, on demand on iTunes and on YouTube and on my site, GaryBaumgarten.com, where you are invited to comment on my comments, whether I agree or not. No retribution. Feel free. And thanks to our good friends at CRN Digital Talk Radio. We are syndicated coast to coast across the United States of America into 12 million additional households. I am your host, Gary Baumgarten. Serious issue underway in Burma, as I call the nation. And that's, you could call it whatever you want. I'm calling it Burma. That's my choice. They're having trouble getting aid to the people in Burma, as you all know. And I wanted to bring somebody on today who could talk to us about the political, the logistical, the infrastructural issues that are causing there to be such a delay in getting the food to the people. So we've invited Oxfam America to bring us an eminent expert in the area of humanitarian relief. Her name is Dr. Miriam Aschkenasy. She's a practicing emergency medicine physician in Boston. She's a fellow at the Harvard Humanitarian Initiative, a visiting scientist at the Harvard School of Public Health. She's published in the field of international emergency medicine. She's worked all over the world helping people, hands-on, in Nepal, in Tanzania, in Ethiopia, in Mozambique, in Chad, in El Salvador, in Peru, in the Gulf Coast. She received her MD from the Sackler School of Medicine, New York Tel Aviv University program. She completed an emergency medicine residency at the University of Connecticut, a fellowship in international emergency medicine and public health at Brigham and Women's Hospital, her master's in public health at the Harvard School of Public Health. I'll tell you what, if I ever had a real medical emergency, I think you're the person I want to go to, Dr. Miriam Aschkenasy. Welcome to News Talk Online on Paltalk.com.
Well, thank you very much. It's an honor to be here today. Should be an interesting conversation, I think.
It's our honor to have you with us. We are an international, as you know, a very global program. People all around the world are listening to us right now, both on Paltalk and on CRN Digital Talk Radio. I don't want people to walk away from here so frustrated that they feel that there's nothing they can do. So before the show is over, I want to offer people some solutions how they can help. People are very frustrated about the fact, of course, you can't avoid a cyclone, and if a country is impoverished when it gets hit by high winds, there's going to be a lot of devastation. That's what happened in Burma. But there are logistical problems, as we all know, in getting humanitarian aid to the people there. And now we're going on to nearly 2 weeks since the event, and it's got to be in a horrific situation. Has Oxfam been able to get people on the ground as of yet?
Well, I have to tell you, Oxfam is in a very unique situation. We have partners on the ground that we've been working with before this event. And so we have been able to funnel funds through our partners who are already on the ground in Myanmar. And we also are funneling funds to organizations that are hands-on working with the people. So there is a way to get help to people. It is limited, as you referred to, and that is a problem, especially in a disaster of this scale. Really, it is doubtful that even the world's richest countries could handle a disaster on this scale. So revving up the response, getting in there, getting water and sanitation, food and shelter is still really a primary priority for all of the organizations involved, especially Oxfam.
And I know that all the organizations involved are looking at those satellite images of another cyclone that is forming and heading its way towards the Burma Delta right now.
We do have our eyes on that. We have emergency management team meetings essentially every day or every other day where all the groups that are involved in the response, from communications to public health, the individuals that liaise with our partners on the ground, we all sit down, we get people call in from Bangkok, and we all talk about what's happening, what can we do, where our actions are going to be. And so certainly this weather pattern is on our radar screen, no pun intended.
No, no pun intended at all. So do we have a good estimate on how many people are dead and how many people are in urgent need of assistance?
Well, the numbers are very difficult to ascertain, and part of that is an access issue. I think we're comfortably estimating that 100,000 people could be dead, and 1.5 million is the number that we're using as potentially affected. I'm sure you saw the news today. The UN came out with a figure of up to 2.5 million. Until we really have access and get on the ground and do some good assessments, it's somewhat speculative. But we do know that as the crisis is ongoing, without a significant humanitarian response, we can expect those numbers to rise.
And the reason for the increase in numbers has to do, I imagine, with residual health issues as a result of the stagnation, the water, the lack of water, the lack of food, the lack of medicine.
Absolutely. What we're looking at is a situation where people there's both an acute and a long-term situation that's now going to happen. In the acute setting, people don't have homes, they don't have shelter, it's still raining. Even if the new cyclone doesn't hit, they're still in the rainy season. There's no food or little food, there's little or no sanitation, there's little or no access to medicines. So they're still injured, homeless, they're subjected to the environment. All these things really lead up to a bad situation. We're talking about really being weak and tired and susceptible to disease and really having nowhere to turn.
You know, I was down on the Gulf Coast for CNN covering Hurricane Katrina, and it was very frustrating that even here in the United States they were having trouble initially getting supplies, food, temporary shelter to people who needed it there. And I was right near in Biloxi an air base, a military air base, and we saw constantly flights coming in and out. This was before I got down to New Orleans. And one of the things that we kind of thought was, why don't they just airdrop supplies? And I know that suggestion has been raised with regard to Burma, but your organization, Oxfam, suggests that perhaps that's not the most cost-effective way of getting